Okay. Yes, everybody, that we have microphones. We have microphones on the ceiling, and I know there has been a lot of interest in the first half of this morning. But guess what? We have microphones on the ceiling. So if you're whispering, the microphones pick it up online, please, and they're very sensitive microphones. So please be advised that we really need your attention here also, so that people online are actually hearing what's going on from the speakers and not hearing conversations along the way, but don't worry. Okay, I think we're all back now and ready for the next segment before lunch. So let's kick off with Rabin again, and very clearly Dutch National Coordinator Against Discrimination and Racism, whose birthday it also is today. So, a very, very special thanks for coming across the border just for us. Thank you.
Thank you very much. And I knew that this would be a great gift, so that's why I'm here. But I'm sorry to say that I will not be able to join the afternoon program, of course, and tomorrow. Because, yeah, one has to pay also attention to the family, isn't it? Dear friends, thank you again for having me here. So let me focus a little bit on my task, but also on 3 discussion points that I brought along with me. So I'm going to tackle a bit about the role which I'm playing. I'm going to give you some examples what I've done, the main challenges, and of course the whole healthcare discussion. My role is as National Coordinator Against Discrimination and Racism. It all originated actually from the Black Lives Matter movement, which was tremendous in the Netherlands. Almost 80,000 people for a small country like the Netherlands went on the streets to demonstrate. But there was also something else going on. And obviously you all perhaps know about the child care benefit scandal. Which happened. So these 2 facts actually made it possible for Parliament to pass a motion, to endorse my position. But there was one tiny little other thing which was important. And that was that after a struggle of 7-8 years, our Prime Minister at last acknowledged, that there is racism in the Netherlands and systemic racism because, he ignored a black face, for example. He ignored the whole colonial history which the Netherlands has, and and at last he was convinced, and that made it possible to come to appoint somebody in this position with a specific task, and the task was, of course, to make an annual national plan. So, like NAPAR, which you have, of course, from the EU body, and also National Congress. So that is a specific assignment, but the assignment is the National Action Plan, which is very important for the Netherlands, And I've made 2 of them already with around 91 specific actions, which are being implemented right now. And I'm moving forward, to see whether it is relevant to have every year a national action plan, or shouldn't we have a national plan or on a longer term, you might say for 4 years, perhaps 15 years. That is what I would prefer, of course. And I fulfill my task in 3 roles: as a connector, as a driving force, you might say. So the driving force is a very inconvenient one because they don't like it, because that is the role I play, where I tend to fame people, but I tend to shame them. So they see me as a pain in the ass, to use that word. But that is a very important one, to put institutions, but also people in an inconvenient position to move on, but also on the action points which I made, which is being implemented. I'm the watchdog. So that is really important to have. Yeah, I need this to shift, but then I can look at the. Okay, so I take that as yeah, connecting government departments, politics plays a very important role, but also the grassroots organizations. So which is for me very important. So those are the three fields I'm moving on, and obviously from the grassroots, the connection is very vividly present at the department level. So that means at the ministerial level, it is quite difficult. The pushback is very harsh there, and politics, politics is politics. I'll give you a couple of examples now what we've been doing actually in the last a few years. The Dutch Association of Banks, for example, and the profiles they're doing on ethnicity. So we have a law in the Netherlands against laundering and terrorism. Mind you, it's strange that terrorism is connected with laundering money. So that is something which is strange. But this is the bill, this is the law. And this law enables financial institutions, to profile people and organizations like mosques, mostly Islamic organizations, and so much so that they're not even allowed to open accounts, for example, or if they transfer money not only to Morocco, Turkey, or North Korea. I don't know who's going to do that, but even in the Netherlands, specifically in the Netherlands, still you're being profiled because you're going to get a call. What are you doing? Why is this money for, etc.? And you see that many people are profiled on the basis of this law. So I have called upon the government not to abolish the law, because obviously we have to do something with money laundering, but to evaluate that and see whether the law is not abused actually by financial institutions. And there has been some research by the National Bank, but also the associations of banks, but also by the Ministry of Finance. And yes, you see that it has loopholes which are being used, to make this abuse possible. So that's one example. The second example, which we were very proud of, along with many organizations, and of course, this is not a struggle which was done recently. I mean, this is a struggle the Dutch African community has been doing for the last 40, 50 years, is to get the apology as far as the slavery history is concerned. And indeed, last year, on July 1st, was a very historic day that the king apologized, and the times had changed. I mean, that was his Obama moment, actually, but that was really a very interesting moment, because in Surinamese Creole language, Sanangtongo, it says, "Denketi koti," so the chains have broken, put through, for surely, so truly. So this was really a very important statement he made, but he went further than what I had expected, because he also asked the community for forgiveness. And that is something we need to think about. So obviously, this is a very important one. So then the commemoration year started, and it's going to about on July 1st. So next Monday it's going to be ended. But then we have to think about what have you done. So and I'm I'm very glad that the apologies were there, but I'm really very disappointed in the action points which have been taken into place to bring communities together. We have had 200 million euros to do something, but what they have done, with the 200 million euros, they have accommodated all kinds of functions and theaters and plays and research, etc. And so it was like what the Romans did in those days, throw some bread for the people and they will be very satisfied. And in my humble opinion, actually, the 200 million people should go to three things, and that is education, education, and education. So that would be, of course, the most important thing, not only to create awareness, but from that awareness, to bring people together and to let everybody walk in our own history, and that has not been done. Another example is the equalization of social arrangements, which has been done in the Netherlands, especially in comparison with the European part of the Netherlands and the Caribbean part of the Netherlands. So that is very important. The accessibility standards in the construction of new homes, for example, so disabled people. I'm very glad that there is in this building, obviously, a toilet for disabled people. I hope so, because I went to the toilet and the doors were that small. If I would have been in a wheelchair, I wouldn't have any access, to the washrooms here. So we don't tend, when we create something, we're not inclusive, because the norm, that's my problem. The norm is something completely different, and that is a very strong, wild, able people, etc. But, in the Netherlands, for example, we have 17.9 million people, out of which 2.2 million people, are challenged on the one way or the other. You cannot ignore them. You cannot ignore them. So it is very important, to have those standards in policy making. So that is very important. The unilateral government action in the equal treatment legislation, so that counts for the Netherlands, but not for the Caribbean part of the Netherlands. And this is something which is an elaboration of Article 1 of the Constitution of the Netherlands, and that's the non-discrimination article. So how can we have an inclusive society when the non-discrimination article is only in place in European Netherlands and not in the Caribbean part of the Netherlands? Because of that, you deprive people from certain rights, for example. The protection on the job market is one of them. No judicial aid, for example. There is no anti-discrimination bureau, for example, where you can go and have some advice, and etc., etc. Your pension is not really managed well when you are an LGBT person, you might say. So there are many disconnects, and we have to do something. Although there is an implementation of the so-called rainbow ballot box agreement. Before election, they tend to sign these kind of things, a kind of a rainbow ballot box agreement. So they want to show, we want to have an inclusive policy. But after election, they forget that they have signed this. So no specific action points are put in place to fight this. So this is a challenge. Next slide, please. Yeah. And so what you see is that there are three, as I mentioned in my introductory speech, that there are three challenges which I'm faced and where I'm moving, and that is indeed the everyday discrimination on racism, the institutional, you folks call it structural racism, I read just now, and of course polarization, which is a diplomatic word for political racism, I would tend to say. So this is very troublesome. I'm not going very specifically through it, but as you can read, it occurs every day, of course, but the most important thing in this aspect is perhaps not only the physical aggression, but also victim blaming. I mean, we have had an election last year in the Netherlands, and what's surprising? They won the election, the party who won the election, and the main discussion was about migration and about asylum seekers. But if you look at the figure, they forget the figures, right? They don't tell you the figures. So everybody thought, that many people were coming into the country. And then they showed all kinds of pictures, how they were received and whatnot. And then there is a problem. But for the people who are going to vote, the problem is the asylum seekers, because they are the cause of the fact that they don't have a job or schooling or whatever, housing, for example. But it's not actually their fault. It's the fault of those who fail to make policy, to make for them a better place. So the victim blaming is very much in place in the Netherlands, and that is something which is also troublesome. The institutional part is there, and it is becoming more and more clear what is happening, and are small things perhaps, but we're not very inclusive as far as policy is concerned, whether it's written or unwritten. It is important to realize that structurally ingrained and often not immediately recognizable things are happening. So we have to focus a little bit on that. And these examples are as such that it's not only discrimination on the workplace, for example, or gender inequality. The Netherlands is on place 27 worldwide. So that is something to think about that also. Reports on institutional racism of the Ministry of Foreign Affairs, for example. I mean, a ministry which should be very much open towards the world. You see that there is discrimination in place, not only at a ministry in The Hague, in the Netherlands, but also at the missions, where people call other, I mean, for example, which was very striking for me, we're talking about people of African descent here on healthcare, but one of the things was very striking for me, and I became really emotional that, we have a mission in Africa, and, people working at that mission call the people in Africa, apes and, things like that. So, I mean, how can you do that? And how can you then be a civilized country or tell that you're a civilized country while you are, putting name on all these labels. And healthcare is, of course, one, but this is something which is indeed something which is all over Europe, perhaps even in the United States, for example, and perhaps other parts of the world. And the unwanted polarization is very visible. A hate expression, have ample scope. So the hate expression, and I'm not only talking about hate expressions online, which is anonymous and then quickly done, but also on the streets. And I must say that looking at the Netherlands, women are in the forefront to get the whole bullets, you might say. Muslim women, for example, but also women in general. LGBTQ people are also in the forefront. So things are getting institutionalized because of polarization, because we tend to think that what used to be not normal is normal now. And people who we thought that they thought things are normal, are making that what is not normal possible, actually. And that is indeed also something of a challenge which we have to face. Okay, but we're discussing here the healthcare issues, actually. And there are three things I want to point out. And I'm not going to, because these are articles which, and you can have the slides if you want, so that's not a problem to, click further and read what is happening. But these are some examples I've brought on the discussion. But the main thing is the abuse of outdated and unscientific distinctions. This is something which is very interesting, because talking about healthcare and the abuse of outdated onto discrimination, racism, you have to peel two layers, actually. And the first is that, unfortunately, in Dutch healthcare, outdated and unscientific distinctions as race and ethnicity are still used, and they are leading to abuse. Race is, as far as I'm concerned, an outdated and unscientific distinction, between groups of people based on physical characteristics that have been lumped together, which is not medically or biologically actually relevant. It's a social construct that is present at a biological which is presented as a biological fact, and that leads to patients at risk and the unwarranted creation of health differences. We could give you a couple of examples on this, but using ethnicity is really a problem when you're not put that into account that it can bring people in very dangerous positions, and we have seen that, of course, in some examples. One of the examples is, for example, and that is really the way pregnant women of Turkish origin, for example, are treated. They are asked, for example, to do a test because they are Turkish, and would be a greater risk of, diabetes, for example. But you can also approach these kind of things differently by talking about the diet they're taking, for example. So the awareness is no longer there, and that makes it a little bit difficult. The lack of inclusion in knowledge, which is something all over, not only in the healthcare system, of course, but also for example, in the education of police officers in the Netherlands, which, the diversity is not taken into account, and then it means that you're going to exclude people on the basis of certain characteristics, and that is what we don't want. So I advocate, actually, if you talk about the lack of inclusion in knowledge, I would see that that is being tackled, in knowledge, because the knowledge cannot be tailor-made in the healthcare system. It should be a broader and more intersectionally diverse knowledge to reach inclusive healthcare, actually. And but we need to do it based on biomedical relevant and very specific and narrowly defined factor. Bless you. Yet in healthcare, the men, for example, white, cisgender, heterosexual, average BMI, without disability, is still used as the implicit standard. And that is something which is so difficult to tackle. We have to break this down. This standard and this has an adverse effect on patients and clients who deviate from this standard because little account is taken of diversity in knowledge production, research, guidelines, technology, medication, and medical education. So this is something which is very important to me. To give you also an example, I mean, I have visited one of these healthcare places in The Hague, and I saw how they, if you get a heart attack, then you get defibrillated, but they are trained on a doll, but this doll is a male doll. So to do that, you're trained on a male doll, and if you do that, it won't work, of course, for a female. Because for a female, you have to take the breast up to put it very tight beneath it. They don't get that training. So if a woman gets a kind of heart attack, then she's likely not to be helped by people outside. So this is what training does, for example. And medication, which is only tested on men, are prescribed for women, for example. And not all the medication which we have work for people with indeed a pigment or whatever. So you have to take that into account because society has changed, and we cannot say that let's go with the flow. You cannot go with the flow. Only dead fish go with the flow. So you have to make a difference in that sense, and that's why it is important, to have knowledge in inclusion. And the third one, which is going to be my last point, is that discrimination in the workforce and the consequences of a non-representative workforce is important one. If you go to hospitals, or healthcare institutions. Yeah, it is not very diverse, right? It's not diverse in people working there. It is not diverse in the curricula which is in place there. It is not diverse in the treatment itself, which is in place there. So there is a lot to be done. And you know, if you look at these articles which I've brought along, you can read that indeed we have recognized that female surgeons do better work than male colleagues. Selection for medical studies is being overhauled in to increase diversity. You know, these are indeed recognized, these kind of things. But what are the actions put in place? And that is something which I hope that you folks will focus on today and tomorrow. And I'm really very anxious to hear about this because I can have an advantage. I can take advantage of your ideas, you know, to put it also in the action plans in the Netherlands. So combating discrimination and racism in healthcare of people of African descent, it's an issue, it's a challenge because we lack to realize, you know, that the diversity has have had an impact in a society like that of the Netherlands. So we need to combat discrimination within systems and in biases of health professionals. We need to push for more diverse and inclusive knowledge. And at the same time, there is an urgent need for more representative intersectional diversity in healthcare professionals. So what I don't want, you were talking about the tree earlier, you know, there was, so let me use that metaphor of the tree. If I talk to institutions, you know, then they tell me, Rabin, yes, of course, these are your, we're doing this. But they are focusing on only the branches and the leaves, right? They're not focusing on the trunk and on the root itself. Because the trunk is, you know, to anchor the inclusion policy within your organization. And that is what brings a lot of trouble, actually, with it. And of course, the root of the tree, you know, yeah, that's a systemic thing. And that is something which we have to break down. But if we stick to the branches and the leaves, that is visible, that is easy, that's a quick win. But with that win, we will not make a change into society. So I would like to conclude with advocating indeed those three things which I've mentioned before. And I think it is, and we could focus my story on several fields, you might say, but we're talking about indeed the medical side, so the healthcare system. And the healthcare system is perhaps one of the most important system for human beings, not to, you know, on which we are faced, because we have to be sure that equal treatment is for everybody accessible, but that we are also entitled to get that equal treatment and to get that insurance that if I go to a doctor, I'm treated well. I'm treated to the best of their ability to treat me and to focus also on my well-being in society. And that is something which is lacking, and I'm sure it's not only lacking in the Netherlands, it is lacking all over, and we have to tackle this. If we don't do this, then our children and grandchildren will inherit a system which will not be beneficial for them. So, ladies and gentlemen, I would like to, I would like to draw your attention on this, and if you have some specific question, I would love to take it. Thank you.
Not so fast, Rabin. And other speakers with this morning, be prepared. So we've done a lot of listening, and we've also had a few requests to say, when do we get to say something? Starting from now. Burning questions. We have time for, I would say, 3 before we have to cut to lunch, because I will basically do a 2-second wrap up. So from the floor. Yes. Could you say your name and the organization that you're representing clearly, because people are online as well. And online, type in your questions.
Hello, hi. My name is Marlies Andre. I'm from Germany. I'm representing the Marisa Foundation. And we work closely, or we've had cooperations with your German counterpart, who's the Independent Commissioner for Anti-Discrimination from the federal government. And I mostly work around healthcare because I'm a trained doctor. And one thing that bothers me is that our version of the anti-discrimination law doesn't cover the scope of anti-discrimination in healthcare. And there's this perception that when this name is used, independent commissioner from the federal government against anti-discrimination, people have this perception that, oh yeah, if I contact this person, then I'll be able to get help.
Yeah.
So my question is, does this fall under your scope? And if yes, have you had any success? And can you give us one concrete example, just to quickly give you context? In Germany, healthcare and anti-discrimination, there's no set precedent, so to say, and there's just a bunch of laws scattered all over that kind of hint on something. But concretely, if you told me that I've been discriminated by a doctor, they would tell you to go to the internal hospital administration or report them to the state, but there's no concrete phase to address this concern. Thank you.
Herzlich willkommen. Good that you're here. I have been to Berlin indeed a couple of weeks back because your Staatsministerin had also a conference, Ms. Alibali, and she is indeed very much involved with the government itself. And I saw indeed that she's making all kinds of plans. But if you see how the plans are realized, then it's not going to be realized because there is no money for it. So that is one thing which is very important. So you need the means. So that's one thing. Indeed, I have an independent position in that sense, to be the connecting position, to have the connecting position, and to put debates on the political and the social agenda, you might say. But I don't have the means and the tools, to help people as such. I don't need that because in the Netherlands we have 16 organizations doing that, and it's called the anti-discrimination bureaus, and they have the means and the staff to do this. So if you're facing indeed something discriminatory, then of course there are a couple of bodies, so the anti-discrimination bureaus, and they are here. Article 1, for example, and Amsterdam is here. So you can go there. Mind you, I'm not very happy in the way they are organized right now because I'm really fed up, that they don't get the means fully right now. So I'm very much advocating, to get them more money and position them rightly. And that is not being done because they have to have some more specific tasks than they have right now. So that is the second thing. And indeed, we have, of course, two other bodies which are very important, and that is the College of Human Rights. You have the College voor de Rechten van de Mensen. So for human rights in Utrecht we have, and of course the Ombudsman is there. But I know what you mean. So I wouldn't say if you have a problem at a hospital, you can go, to, I've done that, to a person sitting there and saying that they are for you. They're not for you. They're for the system. They're for the system. They are to protect the system. They have to protect that they don't spend a lot of money, etc., etc. So I don't believe that. I believe these people, and I believe the change we are about to make, to have a other kind of organization, you might say, with means and with power to make that change. And that is what we're focusing now. We're not there. It will take a couple of years more, perhaps. But yeah, we are not Usain Bolt, having a sprint. We have to take the marathon, and that will take many, many years.
Indeed. So we've now got time for one extra question. And whilst I'm waiting for a hand to go up, I just wanted to add. Where's the hand? Okay, great. I'll just say very, very quickly then. 16, we've been doing a lot of work on discrimination on the grounds of health status at my volunteer foundation. Germany is a case because generally speaking, there are 16 countries that that are protected populations where the first line of discrimination is on the grounds of health status. Belgium is one of them, so is the Netherlands. So Germany is not. But there are workarounds. Now you'll see Darius coming in, can't see him in the room right now, but he'll be here this afternoon from the Equalities Network. And also I saw on the list a couple of people from UNIA.
There's a sick, he will maybe come tomorrow.
Okay, so I also saw people from UNIA, so they can actually give you a lot of detail. I was on the working group related to equality data, grounds of health status representing obesity. So you're absolutely on the right track asking those questions. Really, really happy. The gentleman with the hand, can you give your name, your organization?
Thank you. I'm Omar. I work at the European Parliament as an advisor to Samir Rafela.
Wait, sorry, could you say that again, please, a bit more slowly? You're on mic.
Oh, to this mic.
Yeah.
I'm Omar. I'm an advisor to Samir Rafela at the European Parliament. Sorry for my voice. Thank you, Mr. Rabin, for your intervention. Really appreciate it, and also your line of work. Really quickly, looking at the new government in the Netherlands, and looking at where the health posting will go to which minister, how will that resonate with the right of health of people with African descent and broadly people with a migration background in the years to come? I'm afraid that part will be overlooked. How will you, your office, or your team, or anyone else make sure that the minister in question or the entity in question will not exclude this large portion of the population in the country?
Yeah, that's a interesting question, of course, and I don't have a bowl, looking what is going to happen, but I feel the way you feel actually. So if that happens, so you have to wait, what the plans are of, because indeed the healthcare ministry is going to the PPP government party. Every now and then she has been very professional, the minister designated is very professional in addressing the topics, but of course there's also a political ideology behind it. What am I going to do? I'm going to step on her. I'm going to be there on the pavement of that ministry, so to speak, to challenge her and to have the debate. So, and I have a couple of instruments. Of course, it is going to be really a challenge to fight a system, which is things which are going to be politically also institutionalized. But I cannot keep quiet in this. So I have a couple of means. The publicity is also mean, media is mean, which is very important to me, but also ideas are very important to me. And that's why I am here today on my birthday to get those ideas. And I know I'm not going to be the whole day, but I feel, and I really feel, that we here together are the wings beneath our wings, actually. And we need to support each other in this, and it's also crossing the borders. So I would like to learn from what is happening from the European Parliament, for example, but also what is the evidence-based program, which can be best practices from NAPA, for example. And I'm really studying on that, and I found some things not on the healthcare, for example, but on other terrains, but it is important to get those best practices. And even from the United States, Canada, for example, which is a very interesting country in this sense. Canada is my example, you might say, along with New Zealand a little bit. But so there are countries in the world where best practices are being made. And to conclude, I have told the Dutch government to look closely at the public sector equality duty in Great Britain, in England. So England has, I think it's a good example, it's the best example, the public sector equality duty. So that means that this duty is put into place when policy is made everywhere. The healthcare sector, the NSH does it. And that means that with this Public Sector Equality Duty Act, they are doing their utmost best, to bring the whole community, make it visible with all the challenges they have, And if there is a distinction, or if there is something which is discriminatory, then of course this act is being used not to implement that policy. And I have told the Dutch government, let's look at this closely. Ireland is also doing this, and this can be a very interesting thing. But I don't know yet. Fortunately, there is a research going on this, whether it can be implemented in the Netherlands. And at the end of this year, I mean, the conclusions will come forward, and let's see what can happen. But as I have looked at, it can be very interesting for the Netherlands, indeed, in the new period which is going to come. And I hope indeed that that period will be not a very long one. Thank you.
Okay, thank you so much. Thank you all for paying attention and actually posing some really great questions. There'll be plenty more time for that as we move through the rest of these couple of days. I was asked to do a quick lecture. How much time have I got, Thomas? No. So I'm going to give 3 words. Actually, no, 4. So, let me just see, I can't read my handwriting now. Okay, so the first point of this morning is human rights are actually legal rights across Europe. That's the first thing we have to remember. Then the other 3 words relate to naming, shaming, reformulating. Naming, who is actually within this scope? Do we care at this point? That's something for us to take through and find solutions. Shaming, if it's not measured, it doesn't exist. We heard so many interventions along the lines of, we don't even know what the real situation is because we're not able to measure. The third element, which I think was the biggest recurring theme, is making a new norm. So essentially, how do we recreate all of this? Or how do we create something which is actually fit for purpose? So building that system. So when we get back from lunch, which is round about now, yes, until what time do we have?
Until 30:30, we can do a bit later.
Okay, so well, we're gonna give you a fake deadline and say 13:30 so that we start a bit later. We have lunch now, which I do believe is outside in the area. And for those of you online, enjoy your lunch. And we will be back with panels and interaction for the rest of the afternoon today, and then another quick wrap up, and then policy data deep dive for all of tomorrow. So thank you to all of our speakers for this morning. It's been not just inspirational, but edifying and informative. Thank you. Bon appétit.